It is interesting though, because I have not seen colleges really put out monkeypox protocol statements, you know? Yeah, I hear you. Hello, hello. How's it going?
Hello, Kurt. Sounds great. building a better Bay Area, moving forward, finding solutions. This is ABC7 News.
Hi there, I'm Kristen Z. You're watching Getting Answers live on ABC7. We always ask experts your questions every day at 3 to get answers for you in real time. Today, Kaiser Permanente mental health workers are on the picket line demanding more staff to meet a sharp increase in mental health care demand. We'll explore why this shortage and what are potential solutions. But first, students are going back to school this fall with even more health concerns than last year. COVID, monkeypox, and polio are in the headlines and on parents' minds. How can transmission be prevented, and how can you minimize your child's risk? Joining us live now to answer your questions is UCSF infectious disease specialist, Dr. Peter Chin Hong. Dr. Chin Hong, nice to have you here.
My pleasure, Kristen. Thanks for having me on.
All right, I hope you don't mind. I'm just going to take half a minute here to embarrass you a little bit because you've just been named winner of the 2022 Carl Sagan Prize for Science Popularization. Here's the website with the announcement, and this is for your research on a variety of infectious diseases and, of course, for your work helping us all better understand and combat COVID. So congratulations to you. This is huge.
Thanks, Kristen. It's a little bit, I'm a little bit red now, but thanks for bringing this up. It's been really meaningful for me to work with you and a lot of professionals during the pandemic. I think it was so important for all of us to communicate with each other.
Well, it's well deserved. So congrats, and we do appreciate you. And we want to start today's conversation now, get on to the less embarrassing part for you, the part that you're comfortable talking about with monkeypox. All right, we'll start there because Zuckerberg SF General is expanding their vaccine clinic hours. That sounds like good news. Does that mean supply is improving?
No, I think what it means is that we've gotten or are getting to the people who are really intent and enthusiastic about getting it. And I'm really worried about the next group, which is the essential workers, the people who can't take time off work, the people who are closeted or are not comfortable with lining up in a public clinic to get a monkeypox vaccine. I think for that next level, we have to do a lot more outreach so that transmission becomes controlled.
No doubt. Speaking of groups that may be in greater danger, that would be people who live in communal situations who face their own risks. And today I want to focus our conversation on college students going back to school. We'll have many more conversations about monkeypox, I'm sure, but I do want to focus on that because this is when it's happening. Parents are moving their kids back to school. How concerned are you about that type of living environment in terms of the places and risks and the potential contact points?
I think that's a great question. For now, I'm not very concerned, but again, I'm not very concerned right now. But again, as things change, our risk assessment will change. It may change because, like you said, college students are in a very unique environment, a lot of contact. They're very communal. We've seen other diseases spread in that setting, like in wrestling teams and college campuses, like Staph aureus. So I think right now, low risk or very low risk. But again, if we don't control this, it may bleed over into the general population, and college kids may be that population that may be the transition group.
Yeah, I mean, it seems like I haven't seen a lot of universities really address this the way they have COVID. So let's talk about how to minimize their risk. And, let's start with just how it's transmitted and the kind of close contact and, information students should know as they make their decisions.
Yeah, so I think what's really crucial for everyone to know is that there's a hierarchy of risk. By far, the majority of risk is skin-to-skin contact over and in an intimate setting. The reason why this is an important point is because at the end of the day, monkeypox is an animal virus, and it's really hard in general to get it into a human. It's not like SARS-CoV-2 or other viruses that are more niched in humans. So you really need to have a high inoculum, make a hole in the skin, which is from rubbing, they make these microabrasions and you can get the virus across. After that, then, bedding, if somebody has scabs and they have monkeypox and they lay on the bed and you flick the bedding, those scabs can go up in the air and you can breathe it in. But respiratory spread, you need 3 to 6 hours at close contact, like deep kissing, but not 15 minutes for COVID situation.
Okay. But I mean, a lot of parents have asked, and I've seen this on, Facebook groups with parents, their kids do go to parties and nightclubs in which there may be hours of sustained contact in which you're very close to people who are, sweating close to you, and there's respiratory exchange and all that. Would you suggest kids avoid that? I mean, I guess you can suggest it. They're probably not going to anyway.
Well, I think it all depends on your risk threshold. Right now, in your average setting, like going to a festival or a concert, the risk is generally low in an average person having monkeypox, because you have to think that your average person that you're going to meet has monkeypox, which is different from COVID. And with that exposure, you're going to get monkeypox. At the end of the day, some risk mitigation strategies might be wearing more clothing. We know that when people are in public and they have rashes, if you cover it with clothing, it's much less likely to transmit.
Okay, let's talk about some of the particulars of dorm living, right? We have communal laundry rooms, dining rooms, bathrooms. So talk about any potential risks in those settings and what you can do to mitigate them.
Yeah, so I think probably the highest risk, again, would be in intimate settings when college students get together. But apart from that, and then the person has to be having risk behaviors, multiple sex partners beforehand. But apart from that, other communal settings might be in high contact sports settings like wrestling. I think that's like a typical kind of situation in college where you can have a lot of transmission of skin to skin, because unlike football, for example, you're clothed, you're in gear, wrestling is a little bit more exposed. That kind of stuff. Less so in the dorms for your average. I mean, you could be cuddling next to someone. It doesn't have to be sexual for a very long period. But again, the person you're cuddling with has to have enough risk for you to be worried.
Right. I mean, isn't that cuddling possibly, I mean, we don't know for sure, the cause of that case, the first suspected human to animal transmission of dog owners in France to their dog?
Yes, that is definitely, well, not definitely, but highly likely as a cause of why the pet of the couple who had monkeypox got monkeypox, because the dog slept in their bed and got it 12 days after.
Right. And so that is a concern too, like the bed, because as you know, college students in their dormers, they sit on their friend's bed, on their sheets, right? There's not usually couches. Is that something to be concerned with?
Again, with the level of your average person having monkeypox, not at this point. Okay. I mean, I think it's important to know that there are silver linings as we get more and more vaccines, because the incubation period of monkeypox is so long. Even after an exposure, like say you were in a dorm situation, but you found out the person you were with a couple of days ago has diagnosis of monkeypox, you can get a vaccine and arrest the disease progression completely, even after the virus is in you, within 4 days.
All right, and I just want to revisit this, and I think I can anticipate that, the risk will be very low, but I've seen parents ask about doing the laundry, right? Should they start using hot water? Should they not, should they do a pre-wash or clean the machine, so to speak, do a pre-wash cycle? Are those things that you would consider?
Well, definitely, the thing about monkeypox, as opposed to something like, say, norovirus that causes that diarrhea and vomiting in cruise ships, monkeypox has an envelope, and I'm just reaching out for my monkeypox here. It has an envelope. So this envelope is like super fragile, and you can use detergent to really disrupt this envelope, and it's easy to destroy. So regular washing, and the CDC recommends that, would get rid of the monkeypox. I think on surfaces, you may, if somebody has known monkeypox in your living situation, the CDC and the EPA actually has a great site, because in the back of every detergent or disinfectant, you can see a number. You can look it up on the EPA website, and it can tell you if it's effective against monkeypox. But something like Clorox definitely works. Again, this envelope is very, very fragile.
Okay, that's good to know. Look, early monkeypox infections, they share some of the same symptoms with COVID, I think, right? Sore throat, nasal congestion, cough even, that could present before the lesions. So given that, what should people do if they're not sure what they have?
Yeah, so, I mean, I think we should have a very low threshold for checking and doing a test. Of course, in monkeypox, a lot of people focus on the skin, but there are a lot of things you can have before the skin, particularly if you have lesions in your mouth, in other places like in your urethra or rectal area. You can encourage your clinicians to send that for PCR. But the big difference between COVID symptoms, which look otherwise similar in monkeypox, is that you have big lymph nodes with monkeypox. So that might be a tip off for some people to get checked. The other thing is not to panic. The rash will come maybe a couple of days after. And if you're severe, we have more and more therapeutics that we can give people as well that can hopefully soften the blow of disease.
Right. All right, Dr. Peter Chin-Hong, don't go away. Monkeypox is not the only concern right now. There's also polio and, of course, COVID still there. So Dr. Chin-Hong will be back after the break to address those topics, and he'll answer your questions right now on ABC's Facebook live feed. All right, everybody, thanks for joining us today. Dr. Chin-Hong, I see a lot of congratulatory messages here on Facebook Live. A lot of people, Marie saying congratulations, Doc. Chad says congratulations. David says great work. So we're just going to spend the next 2 minutes embarrassing you, I think.
I know, that's so wild.
No, I'm just kidding. Folks, if you have a question for Dr. Chin-Hong, please ask it. Lockman wants to know, how do they monkeypox test? I'm sure, are you asking how do they test for monkeypox? Yeah, Dr. Chin-Hong, what can you tell her?
Yeah, so I think the lowest hanging fruit for how clinicians test it right now is if you have a rash, they basically take a swab that's not a cotton swab. So make sure it's not a cotton swab. And they swab it on you like a Dacron or polyester swab. And they just put it in a tube, dry, and they send it off for testing. There are 5 commercial labs that can do it now, including Quest and LabCorp and some of the big ones, as well as the CDC and state. So tons of capacity. I think it's easy to send that test. I think more people should be sending that test. If you have lesions in your mouth or in your butt or in your or urethra, you can also send a PCR from that area, but I think many clinicians are not used to sending those as yet. But it's just like COVID. You can PCR basically any secretion.
Okay. Also a question about, do we need to get vaccinated for monkeypox? What is the current thinking on who needs to get vaccinated?
Yeah, so the current thinking is, because we don't have enough vaccines yet, even though we're hoping to increase that by 5 soon, is the men who have sex with men and trans people who have sex with men population, because that's where most of the disease is. Hopefully, when we get more vaccines, we can widen the group.
Mm-hmm. Do you think eventually, how soon before healthcare workers, you think?
I mean, healthcare workers with some credible exposures could get vaccinated, and lab workers now too. But, I think they're already talking about college students.
All right, let's come back on TV.
4, 3, 2, 1.
We are back with UCSF infectious disease specialist Dr. Peter Chin-Hong and the winner of the 2022 Carl Sagan Prize for Science Popularization. I promise I will not mention this beyond today, Doctor. Today, look, we're focusing on disease prevention as kids return to school, college campuses. We covered monkeypox in our last segment. Now we'll turn our attention to polio and COVID. So, Dr. Chin-Hong, polio has been detected in New York City wastewater. What does this mean about means of spread and how widespread it may be?
I think a lot of people are worried, but not panicked again. They're worried because the fact that all of these samples in 4 geographic locations now, there's 1 in Rockland County, 2 in Orange County, not our California Orange County, but New York Orange County next to Rockland, and then 1 in New York City, they're all detecting the very similar genetic fingerprints of poliovirus, meaning that it may have been this individual who came from, is from Rockland, went abroad for a while, came back, got polio and is paralyzed. But he might have transmitted it to a lot of other people. We're not really sure. But whatever happened, a lot of people are having it in their system and shedding it in their wastewater. And that's what they're seeing.
Okay, look, until this recent uptick, the polio vaccine had virtually wiped out the disease for generations of Americans and people around the world. Why the resurgence right now?
Yeah, so there are 2 things. One is that, not everybody's becoming immunized at the rates that we'd like to see. And immunizations have actually dropped for the first time in 30 years during the COVID pandemic. We don't even have the actual numbers yet as to the immunization rates. California has some of the strictest laws where it's you need medical exemptions rather than personal.
Yeah. Otherwise, you can't go to school, right?
Yeah. A lot of people are doing homeschooling, so I think that is not captured by the official numbers, which is looking at the percentage of kindergartens with polio vaccination. We saw with the Disneyland measles outbreak that there are actually pockets of unvaccinated individuals in California for routine childhood immunizations.
All right. So if you are vaccinated, though, and got the whole series, are you 100% protected? Like you're not going to get it?
I never like to say anything is 100%, but it's in the high 90s in general. We think that, immunization protection after a series in childhood will carry on. Mm-hmm. But I would say that putting on my science hat, it all depends on everybody else around you. I think it works that way because our immunization rates have traditionally been so high. Right. So it doesn't matter if you have like a little less protection than your neighbor. Your neighbor is so protected that he or she is protecting you.
Yes, that's how public health works, right? You were talking about some of the kids who are homeschooled that maybe didn't, have to meet that school entry requirement, didn't get vaccinated. I should just mention State Senator Scott Wiener of San Francisco has a bill letting 15 to 17-year-olds make that choice to get vaccinated for anything, vaccinations they choose without parental consent. Do you support that?
100%, because again, public health isn't individual health only. It helps the individual, and that's a bonus, but it helps all of us. And I think this polio situation with wastewater detection, not only in New York, but also in London and Israel, this is all happening all over the world right now. Mm-hmm. That protects all of us.
Okay. Do we as adults need a booster shot given the situation with polio right now?
I think the CDC has traditionally recommended boosters for people at higher risk of re-exposure to the real thing. So like if you were traveling to Afghanistan or Pakistan, that might be a time to get a booster. If you're going to the Hajj in Mecca, some countries require proof of polio vaccinations. Some countries require proof of polio vaccination before you exit so that you don't bring it back to that country. Okay.
I want to turn to COVID for the last couple of minutes we have. Look, many colleges are not doing arrival testing anymore this year or even providing rapid tests anymore. Do you think the time is right to end those procedures?
Well, I think, it's controversial in that end. I think at a beginning point, it probably is a good idea to do a sort of like sweep of everyone, but for ongoing testing, probably not for sure. Mm-hmm. I think the CDC is going more towards prevention of serious disease. We do have very, very high levels of immunity right now from going to the hospital. But again, it is disruptive. So that's my only conundrum. But overall, if pushed, to answer, I think we are in a much better place than we were the last time schools opened.
All right. Finally, I want to ask you, would you give your college kid a booster if they're eligible before they go back? Or would you at this point say wait for the new one that targets Omicron too, like the Moderna one that the UK just approved, becoming the first country to do it? I don't know when that's going to be available here, but what do you think?
If your college student is eligible to get that booster, get it right now. We don't know who's going to pay for it. $10 billion still in Congress. We don't know for what populations it will be approved. In the UK, it's only older populations, for example. And then number three, we don't know when it will be ready. I mean, this is just sort of like, I have confidence it'll be there, but I don't know when it will come. We know it's maybe September, maybe early into October.
All right, Dr. Peter Chin-Hong, the winner of the 2022 Carl Sagan Prize for Science Popularization, for doing exactly that, sharing medical knowledge with us. Really, really appreciate it. Okay, I promise that was the last time I'm going to mention it. But seriously, we appreciate you. Aw, all right, thank you. We'll be right back. And when we do come back, we'll dive into mental health and the critical shortage of workers as many across California hit the picket line today. Stay with us. Getting Answers continues right after this. All right, everybody, thanks for joining us. Stick around for our next segment.
seconds. 4, 3, 2, 1.
Thousands of mental health care workers at Kaiser Permanente began an open-ended strike across California today. They're asking the provider to hire more staff to meet the surging demand for mental health patients. A study by the Steinberg Institute on Brain Health finds there is a critical shortage of mental health experts here in California and nationwide. Joining us live now to talk about that and how the shortage is being addressed is Tara Gamboa-Eastman, a Steinberg Institute senior advocate. Tara, thank you so much for joining us.
Thank you so much for having me.
Look, this strike today calls attention to a shortage of mental health workers. Of course, you've known about that. How serious is the situation?
The behavioral health workforce shortage in California and across the country has really reached crisis levels. In California, only 1/3 of people with a mental illness receive the care that they need. And today, 31 counties with a high need for mental health services report a behavioral health workforce shortage. As a result of this crisis, what we're seeing is the sickest among us are cycling between our streets, jails, and emergency rooms. And with us marshaling all of our resources to support them, those with mild symptoms are not getting the initial care that they need, continuing to deteriorate, and unfortunately entering this inhumane cycle. Really, if we are going to ensure that Californians get the care that they need, we need to make sure that we have a well-trained, well-resourced staff in place.
I want to get into how we can develop that well-trained staff, but let's talk about why is there such a shortage first. Was it a crisis even before the pandemic?
It's been brewing for a number of years and really reached crisis levels during the pandemic. We've seen a healthcare workforce shortage across the industry, and that's definitely including the behavioral health workforce. And there's a number of factors. One large component is that we have an aging workforce and people are starting to retire. Another huge component is burnout. We're seeing staff faced with incredibly long hours, difficult caseloads, and often really difficult working conditions. And then, of course, one of the biggest driving factors is low pay.
Yeah, it seems like there's kind of a vicious cycle going on too, right? The more you have a shortage, the more the existing mental health care workers are overworked and therefore getting stressed out themselves and wanting to leave the field, and then it just kind of compounds. So let me ask you then, you were talking about seeking a long-term solution. What might that look like?
Really what we ultimately need is to increase the diversity of our workforce, address recruitment and retention issues, and really begin to rethink what the behavioral health workforce should look like and who's a part of it. That's going to take making our training and academic programs more accessible and applicable to the real world. It's going to take addressing those pay issues. It'll take reimagining how we work and the way that we work in the behavioral health space. And it'll also mean re-looking at our career ladders and making sure that our workers have a place to grow, are inspired, and continue to be supported throughout their careers. We're really fortunate here in California. The budget this year included a $1.5 billion health workforce investment, which will help address the behavioral health workforce shortage and the workforce shortage throughout the healthcare industry. It'll support workers like community health workers, create a pipeline for social workers, and so much more. But to your point, a lot more remains to be done. And part of the problem in fixing the long-term problem here is we still have a lot of unanswered questions about a lot of the drivers and what some of the best recommendations are. And that's why the Steinberg Institute is partnering with San Francisco State Senator Scott Wiener on our sponsored legislation, Senate Bill 964, which would commission a landscape analysis to really get at the crux of this issue so that we can make those longer term investments and changes in the behavioral health care space.
There's a new resource, or at least a new phone number for the National Suicide Prevention Lifeline, and it's designed to make it easier. Talk to us about the new number, 988.
That's right. 988 is a federal number that was established by Congress and the FCC in partnership with the president back in 2020, and it just launched this July 16th nationwide. Now, callers across the country can simply dial 988 instead of the previous 10-digit cumbersome number and be immediately connected with a trained mental health crisis counselor. If you are experiencing any sort of behavioral health crisis, we want to make sure that you know that you can call that number and be immediately connected with trained staff who can help get you the care that you need.
All right, that is a great resource, but what if, we have 30 seconds, but what should people do if they find that they're unable to get a mental health care appointment in a timely manner and they're really suffering?
If you're experiencing delays through your insurance or provider, you can contact the Department of Managed Healthcare's Help Center by going to their website at dmhc.ca.gov to issue a complaint.
Tara Gamboa-Eastman with the Steinberg Institute, thank you so very much for your time and insight today.
Thank you so much.
Now, if you or someone you know needs an ally when it comes to mental health, you can find local resources by going to abc7news.com/takeaction. And a reminder, you can get our live newscasts, breaking news, weather, and more with our ABC7 Bay Area streaming TV app. Just search ABC7 Bay Area and download it wherever you stream. We'll take a short break and be right back.